All those other detoxes, all those other treatment centers, from private ones to government ones. And this place is actually giving me my life back.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Welcome back to Living Clean, Living Well. My guest tonight, Dr. Kumar Gupta from Freedom from Addiction. He's head of the medical team there. And Daniel Kahn, who is an addictions counselor and also a good friend to our show. It's really great to see you gentlemen here this evening. We're talking about pain management, opiate addiction, pain prescription medication addiction. We've had a lot of phone calls in tonight. We're going to get to you. I just want to give a shout out to our friends at Recovery Wire magazine. Folks, a great magazine. You've heard me extol its virtues before. The editor-in-chief, Dee Christensen, and her team put together an excellent magazine. It's edgy, it's thought-provoking, good articles. So folks, if you'd like to get a copy, just go to their website. It's online at recoverywiremagazine.com, and we've got it up there on the line for you right now. So back to the phone calls there, gentlemen.
Let's do it.
Let's go. Line 6, Jennifer's holding from Toronto. Hi, Jennifer, it's your turn. Go ahead.
Hi. I'm calling, I have a rather complicated case. 24 years ago, I was a full-time nurse, a full-time athlete. I could go on, but I got a terrible flu, ended up in bed basically the next 24 years. I had developed fibromyalgia 2 years later. And I was put on short-acting pain medications, and I'd build a tolerance, and those didn't work. So I went to a pain clinic at Mount Sinai here in Toronto. I was put on OxyContin, and it turned out for 10 years I wasn't an abuser. I took it once, 3 times a day, but he titrated my dose from 20 up to 80 and had to stop there. One of the major complications of OxyContin and other opiates is opiate bowel, where you just, I become totally obstructed and nothing absorbs. No pain medication, laxatives, nothing works. In September, I went in to go through withdrawal off OxyContin. It hadn't worked for 4 years at all. Wow. My pain was 10 out of 10. And I was shocked that on the 4th day without OxyContin in my opiate receptors, I guess they were empty, my pain went from 10 out of 10 down to 5. And I've heard a lot about this drug that actually causes increased pain in the brain.
OxyContin does.
Well, Jennifer's touching a very important point. Sometimes what happens is, as doctor, there's more pain sometimes as you increase the opiate, and doctors sort of get caught up with, and in fact, there's a lot of studies that Jennifer, which is sort of alluding to, that suggests that going higher will not make your pain get better. And in fact, opiates only address 30% of the pain. It's not supposed to address 100% of your pain, so you brought up a very good point, Jennifer.
Yeah.
And sometimes individuals are just thinking, if they go up, that it might help. Right? And just the thought alone of having more in their system can sometimes.
But it certainly helps for the first 3 days.
That's right.
But then after that, it's like you're back to square one, and you're actually having about a little bit more pain.
Right.
And so it's interesting how opiates work.
Jennifer, that is excellent that you brought that up and that you called in this evening. Thank you so much. The fact that the opiate, we learned something, well, at least I did, you guys knew, that an opiate can increase the pain. So thank you for that. Let's go now to line 7. Jane's calling in from Hamilton. Hi there, Jane. Go ahead. The floor is yours.
Hi.
Hi, Jane.
Hi. I just want to know if I can get a bit of help for my son.
Go ahead. Tell us what you need.
His name's Joseph Mills, and he's into crack cocaine. And I just want to get a bit of help from him if I can.
So are you looking for places to take him or people to reach out to? What sort of help are you thinking?
Like for a rehab, you know?
Rehab, okay. Well, the sponsor of this show is Freedom from Addiction. They are located in Aurora, Ontario. We have their information up on the screen. Dr. Gupta, are there other places that you could suggest that maybe if somebody can't afford it and the beds that are available?
I mean, there's many detoxes. I mean, I think the first step is detox. And, you know, often these detoxes will keep people for up to 2 to 3 weeks.
Yep.
And then they have places like transitional places you can go to, which are dry houses. So, you know, it depends on your money situation. But if you're looking for something where the money's tight and you need something OHIP covered, the detoxes are the best place to go. And you know, there's a central detox line, and I don't have the number, but you can actually, I think, call 211, and then you just ask for the central detox line, and they'll sort of give you access to all the detoxes. But that's the first step. You know, there's many other steps, but the first step is getting him into a detox.
Mm-hmm.
I guess my question, Jane, is does he want help?
Yeah, that's a very good question. Very good answer.
Jane, does he want help?
Pardon?
Does your son want help? Is he
Yes,
reaching
he
out?
does.
Okay, so yeah, as you're saying, there's lots of options out there, Freedom being one of them. So it's really, you know, hopefully from your perspective and wanting to try to help him to really get informed as to what's out there and what's available to you, and then get him there as soon as possible.
What happens when you walk in the doors of a center like Freedom from Addiction? Maybe you could just tell people what happens.
Get a big hug.
You do?
Yeah. We, you know, like you were saying earlier, we really try to make it comfortable for somebody coming in, because going back to an earlier caller, it can be very scary.
Yeah.
Walking into a treatment center and not knowing what's about to happen to you, whether it be withdrawal symptoms or treatment or counseling, and not knowing what is going to happen. So it's about making the person feel comfortable in what's going on, assessing really where they're at, and then coming up with a treatment plan. Both medically and counseling wise, as to where we're going to direct this person, and understanding where that person's goals are. We're going to meet them at where they're at as well.
Yeah. So when you first meet a patient, Dr. Gupta, what can you lead us through what happens there?
I don't give them a big hug. But I do.
They've already had the hug. That's good.
But you know, it's really just assessing, really taking down the fear factor. You know, that's where I'm there. I mean, taking down the fear factor of making sure they know that they're going to be comfortable.
Yeah.
That's what they want to hear, and you know, they're there to get comfortable and getting off chemicals. Remember, we're dealing with not just a behavior, we're dealing with a brain disease, which is quite serious. And your brain has changed with alcohol, with opiates, with chemicals, and it's a very frightening thing for patients to be free of these chemicals. And you have to do it in a nice, gradual, warm, like you said, nice process.
Gotcha.
Yeah.
Okay, Jane, I hope that is helpful for you. We're going to have the information up there for Freedom from Addiction. You can call them tomorrow if you like. And Dr. Gupta mentioned dialing 211, and there should be some information there as well for you. Also, our website at abusehurts.com. Look for our little Living Clean, Living Well logo. If you click on that, if you have access to a computer, we have some resources there for you as well. Hope that helps. We've got a question in tonight from Doug from Kitchener. How long is withdrawal from opiates? How long?
Well, opiate withdrawal, there's a immediate opiate withdrawal that happens within 48 to 72 hours, and there's a sustained withdrawal. So the immediate opiate withdrawal is about, you know, about a week. But again, it depends on the medications you're getting. So, you know, we could shorten that, but then the sustained opiate withdrawal is just the low energy part. The kind of, there's a bit of kind of I call it the post-flu season, where you're just tired, you're low energy, you might be a little bit more depressed, you know, and that just takes time, and that's where the counselors come in, and that's where, you know, the big hug comes in, and where, you know, but the key part about opiate withdrawal is always every day becomes, it can never get worse. That you can only go up, you can only get better. It's not like cancer, where you're trying to recover from cancer, you know the end point is not going to be good. I mean, opiate withdrawal, there is a good end point. And once we get through the immediate part.
Yeah, there's the physical withdrawal, which is what you're talking about. And then there's the emotional withdrawal of what's going on internally as well. And that's what we try to have a balancing act in terms of how we're supporting a client through that process.
Gotcha. Right. Thank you, gentlemen. Let's go now to line 1, and Elizabeth's calling in tonight from Toronto. Hey, Elizabeth, thanks for your patience tonight. Go ahead.
Hi, my question and a comment is due to pain medications. Firstly, how do they plan to legalize medical marijuana, as they call it, when it's causing mental illness amongst young people between 16 and 25? I've seen a lot of children and kids in psychosis, and they're not getting out of it. I'm not talking about the hardcore marijuana users. It's not affecting them for some reason. So I'd just like a comment on that.
Sure.
This is quite important because in society today there's a lot of young kids that are in psychosis, and they stay in psychosis for years. So what's the result of this? What's going to happen to these kids?
Elizabeth, I can't answer that question. I can say that medical marijuana came about by Health Canada approval because there was a small set of patients that were dying that have debilitating conditions like cancer, AIDS, epilepsy, where there's been benefit shown. So that's why it came about. You're absolutely right. There are many young people that are abusing marijuana that show psychosis that actually, so it's really one of those very tough, it's a tough, debatable issue. I don't think we have the time to debate it today, unfortunately, but you raised a very good point.
Yeah. It's hard to know the causation, right? You're talking about psychosis being caused by marijuana or not, and it's just so difficult. The THC levels in marijuana now are changing all the time. Marijuana is being laced with other things. People are not really understanding what they're smoking sometimes.
Right.
So it's such a wide spectrum of beliefs right now in terms of marijuana. So it's hard to answer that question.
Yeah, and Elizabeth, when everything all changed at the beginning of April, we actually did a show on medical marijuana, and thank you very much for bringing that up once again. I am always listening to what you folks need. And this show came about the fact that so many people were reaching out about needing help for pain management and addiction to prescription drugs. So I'm listening once again, and in the coming months, we will do another debate on that. So thank you so much, Elizabeth. Keep watching. Let's go now to line 4. Gail's on the line from Nunavut. Hello there, Gail. Thank you so much for calling in tonight. Have you got a question or a comment?
Yes, I have just a question.
Sure.
I'm wondering if Dr. Gupta has recommendations for resources for health professionals on choosing painkillers and how and when to taper off. Because obviously,
there's a big movement of the College of Physicians, which sort of regulates physicians on educating physicians on using opiates properly. There's new guidelines that came out with opiate management. So a lot of new things are happening. There's education out there for doctors, and it's a matter of the doctors accessing that education. So it's still a problem, but I think it's getting better. We're also slowly, I believe, in Ontario, getting better at detecting double doctoring, which is a big problem. And so, I think with time things will get better, but I think it's going to be a long process.
And client self-education, understanding what it is that we're putting into our bodies ourselves. Why is this doctor prescribing this or that or the other? And understanding it ourselves can be part of that. We shouldn't all defer it to the doctors as well. We need to be knowledgeable as well.
Patient education.
Thank you, Gail. I hope that's helpful. Let's go now to line 4. Amy's on the line from London. Hi there, Amy. You're talking to Dr. Gupta and Daniel Kahn tonight. Go ahead.
Hi there.
Hi, Amy.
I just wanted to give a bit of insight and thank you guys for helping and doing what you do in the recovery process. There was a caller that had called in, Jason, I believe, and I just wanted to give him a bit of hope. It'll be 22 months clean from opiate addiction on the 3rd of May. And the pain of withdrawals does suck, but there is hope at the end of the tunnel. And I guess the biggest thing that made me realize that life is just very important, and the life after opiate addiction is so much greater and grander in scale, and it's well worth the pain that you go through in withdrawals. And without the support of organizations like you guys, I wouldn't be here today. And I just wanted to thank you and let Jason know that there's hope out there.
Well, Amy, that's the most. I think that's the best call we've gotten today. That gives hope to everybody out there. So thank you, Amy.
Yeah, you're the light. I mean, this is why we do this. So congratulations. You're the one doing the work. We're just here to support.
I just got goosebumps.
Yeah.
That's what makes me coming back to do the show week after week is being able to share your stories, folks, and to be able to bring in guests so that we can help. And Amy, thank you. Yeah. You were talking about hugs. Amy just gave us.
That's right. Exactly.
We're going to take a short break here on Living Clean, Living Well, but when we come back, more of your phone calls.
It's scary to think that you're going to live the rest of your life without drugs and alcohol when it's all you've depended on. But there is hope. I knew I couldn't do it alone, and treatment allowed me the chance to ask for the help that I needed in order to believe that I could live a sober life. I got the help and support that I needed, and even now that I've left, I still have that support there.
Hello, I'm Ellen Campbell, the CEO and founder of the Canadian Centre for Abuse Awareness. As a charity, we depend on viewers such as yourself to support the programs for First Nations, women and children, anti-bullying, and elder abuse. I invite you to visit our website, see what you can do to share. Any donation over $20 will receive a tax receipt. Thank you so much for all your support.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
You're watching Living Clean, Living Well, and we're talking about pain management, opiate addiction, pain medication addiction, and also your general thoughts and questions about addiction in general. The forum is open, and as we had our last caller, Amy, who was calling in, it's also a forum and where you can give others hope. So thanks to everybody that has taken part in tonight's show. My guest, Dr. Kumar Gupta, he is the medical lead at Freedom from Addiction. And Daniel Kahn is here with us as well, and he is an addictions counselor. So let's head back to the phone lines. Line 2, Ron's calling in tonight from Shelburne. Hey Ron, thank you for your patience, but it's time for your question. Go ahead.
Yeah, I just want to commend you on your program and stuff. This is the more awareness and stuff that we get out there, the better it is for everybody. And I just want to congratulate the last caller that called in on her rehab and stuff. And I just want to tell her to, keep focused and keep going. So I just had a couple of comments and questions that I wanted to address to the panel. First of all, it all started with me when this is just a warning to everybody. There's a lot of people that are into tattoos nowadays, and I just wanted to mention that when I was 15 years old, I got a homemade tattoo from a homemade gun, and I ended up getting Hep C from that. So just to be wary, if you are getting tattoos, make sure you go to a professional and he's using clean needles and whatnot. So anyways, I contracted Hep C when I was 15. Then later on in life, I've had some car accidents. I had some back issues and whatnot. So, I was prescribed some drugs and OxyContin and Dilaudid and whatnot. And I just wanted to say that, sure, it helps the pain, but you actually have to be careful because a lot of the times you can actually hurt yourself because you're not feeling any pain, and to just be careful of that. But anyway, so I've been prescribed OxyContin, and just getting back to the Dilaudid issue, I got addicted to Dilaudid. It was prescribed to me for pain, and just to comment on Dr. Gupta about, they were asking about what Dilaudid was. It's an opiate. Basically, what it is pharmaceutical heroin is what it is. And the thing is that I was injecting a lot of this stuff, which is even worse. But I've been clean now for over 6 months,
Great.
and I'm pulling strong. And another important thing I want to touch base on is I just want to let people know that if you do want help, you have to really want to quit yourself. So You know, the lady was asking about her son that was involved in crack or whatever. You know, he really wants to have to get clean and well. So all the, you know, just want to wish him all the best with that. So just getting back to the Dilaudid and the OxyContin, another thing I just want to touch base on is I think the worst thing they ever came out with is now you can get the generic OxyContin. And I just want to say the best thing they ever came out with is this new OxyContin that you have out, which you can't crush, you can't inject. That's the best thing they could have ever come out with. Now they have this generic OxyContin that you can get, which you can crush and inject, which is very bad. I think they should take that off the market completely. So I just wanted a little bit of input on that. And also, I just had a question because, you know, OxyContin and Dilaudid, they are, you know, sure they help with certain things, but, you know, there's a big addiction factor. And there was a lawsuit that was put forth against Rocha Drugs, because I believe they were one of the manufacturer of OxyContin. And apparently they lost this lawsuit. So I just want to let anybody know, if you've been affected by OxyContin and it's kind of ruined your life and it set you back, there is some money there for you if you look into it. I don't have the information right now, but I just want to get it out there that, you know, if it did mess up your life and your family, you and your family members are entitled to some monetary money for that. So
if people have access to a computer, I'm sure that they'll be able to find that out. Dr. Gupta, he was asking a question there. Go ahead.
Yeah, I mean, you're absolutely right, Ron. I mean, I don't know. I can't explain why they came up with a generic version where you can still crush, store it, and inject it. You know, I'm at a loss for words, as you are, as why they did that. But you're right, the Oxy Neo was a step forward, and then again, it was a step backwards. So
yeah, we keep hearing everybody talking about OxyContin, and I was under the impression you couldn't get it anymore. Am I right?
No.
Obviously not. You still can.
You can get it.
And its name is OxyContin?
Yeah.
Too readily available, I would say.
Yeah, too readily available.
So Oxy Neo, they never...
No, I think Oxy Neo is still out there, but the generic has come back, of the OxyContin, which is Ron is talking about. So.
And congratulations to you, Ron.
On the 6 months.
As well. Absolutely.
Thank you, Ron. Thanks for everything. Let's go now to line 5, and Myra's holding from Whitby. Hi, Myra, you're on the line today. Go ahead. Myra, it's your turn. You still there, hon? I think we've lost Myra. If you can hear me, but we can't hear you, hang on, Myra, and we'll try to get back to you. Let's go now to line 7, and Evelyn's calling in tonight from St. Catharines. Hi, Evelyn. Go ahead. Can you hear us?
Yes, Teresa. Hi.
Hi.
I just want to call in and give you some information here about an organization that's run by the nurses.
Sure.
It's called Niagara Health Partners.
Mm-hmm.
Now, I came across them in a paper, and I hired them because I was put on Oxy cassette in 2012, and I have an excruciating pain. So I hired them, and the doctors doesn't kick me out of the office in 8 minutes or anything like that now. I'll be going to Hamilton with one of them on Tuesday for a test and circulation. So that one, the nurse that goes with me, she works at a Mount Sinai, Princess Margaret and Jaravinsky, and she teaches. It's a great organization, and I'd like people to know that this is available.
Oh, that's great. Why don't you repeat it again, Evelyn?
It's, I got to turn the pamphlet over, Niagara Health Partners.
Wonderful. That's a great resource. Thank you so much, Evelyn. Yeah, you know, I really appreciate when people call in, you know, because you never know who is watching this show tonight that's going, that's what I need. That's what I need. Boy, lots and lots of phone calls tonight. We're going to take a little break from them right now. Dr. Gupta, you know, along with your work at Freedom from Addiction and your work as an addiction specialist, you actually have another line of medical work, isn't it?
So I'm a coroner as well. So I deal with the living and I deal with the dead.
Wow.
And, you know, it's nice to see, it's humbling because you're treating people with addiction, then you sort of see the end result of addiction, which is sometimes death. And you realize how deadly this disease is. And you see young people dying from OxyContin and fentanyl addiction all the time, discovered by their parents, or older people with prescription drugs dying and not understanding the combination effect with alcohol. And so it's a great deal of what we do as coroners is actually accidental prescription drug overdoses.
Really? Is there a lot
great
of it?
deal of it? A great
That's
deal of it. I would say at least, you know, it's not a statistic, but 30–40% of my cases are overdoses.
Really?
Yeah. So it's an incredible journey there and back.
Yeah. Daniel, when somebody's reaching out for help, what's the best thing that somebody could say to someone?
Well, it's just to be there.
Yeah.
I mean, sometimes just listening. It might be the first time somebody's able to listen to somebody in terms of what their experience is and what they're going through in that present moment. And just to be an ear and to be available to somebody and be empathetic as to the concerns that they're having is really something that can be helpful in that initial starting point, because making that first phone call, getting that first point of help is usually the hardest part. Right?
And how about for those family members that are dealing with somebody who doesn't want help?
Yeah.
What's your advice to family members?
You know, the family has to get involved in some capacity. This is, in one way or another, this is a family disease. It impacts everybody in different ways. There's different processes that people could go through, interventions, but it's really up to the individual at the end of the day to want that help and seek that help. But you know, we have to make sure when we're talking to families at Freedom, we're making sure that they understand that they're a part of this, either enabling or being a part of the addictive behaviors or the recovery. And so we're not blaming the families for anything that's going on, but we have to support them in trying to support their loved ones as well.
Yeah.
And that's a difficult thing to do.
Very
it's
difficult.
a really difficult thing to do. Yeah.
You know what we didn't hear a lot about tonight was fentanyl. About the horrible problems going on out there.
It is taking over the overdose rate and the death rate in Ontario. It's actually replacing OxyContin with overdose deaths lately. It's because I think the problem was once the OxyContin was sort of declining, physicians mistakenly believed that fentanyl would be a better option.
Right.
And it's the street value of fentanyl and the abuse is just enormous.
What's fentanyl used for? Sorry, Daniel, I'm just curious.
It's an opiate. It's an opiate.
For pain.
But it's an anesthetic opiate, and it's a patch. But the problem is you can boil the patch, you can smoke it, you can inject it. So
and you don't know how much is in that patch.
You don't know.
Is that how the overdoses are
I think that's why they overdose, because the concentration is so different. And so
it's like Russian roulette.
It's like Russian roulette.
Yeah.
I mean, you also see somebody who's come off these drugs, and then they immediately go back to the same volume and quantity they were doing before, and the body just can't handle it.
Absolutely.
And death can come from that as well.
Wow.
Yeah.
Right.
Generic OxyContin. How long have we been seeing this, guys? When did it pop onto your radar?
I think for about 10 years now, would you say?
At least.
About a decade.
Yeah.
So doctors know that they can still prescribe it then?
They can still prescribe it, but I think doctors are more educated now that they're not using that as a first choice.
Right.
And some aren't even using it as a last choice, so yeah.
I have an elderly relative who was prescribed OxyContin back before everybody knew how addictive and how awful and debilitating it was going to be. And as I feel, you were talking right at the beginning of the show, the fact that doctors, you're not really trained with the addiction side of things and all the rest. Well, now my elderly relative isn't on OxyContin anymore, which is great.
Right.
But I noticed that the doctor was really they've been the powers that be are cracking down on the doctors, aren't they?
Yeah. I mean, there's a lot more interest in opioid prescriptions now, and I think we have to be concerned, right? So it's the physicians are more concerned. I think the colleges are more concerned too. That regulate the physicians.
The conversation has to continue.
Yeah.
More awareness through the conversation has to be heard by not only the doctors, the counselors, but also the people who are out there and understand how impactful these prescribed medications can be in someone's life, and even stuff like sitting around the shelf. We got to know what to do with that stuff and not leave it lying around for people to use.
Yeah, you know, the whole show's been impactful. I have learned so much, and not only from my wonderful panel tonight, but from you folks as well. Dr. Gupta, you said something right off the top of the show that really captured me as well, and it's the fact that, people that are going through these addictions due to pain and pain management, that sort of thing, they were raised in good households. They've got good morals, right? So it's okay if you've got a problem to put your hand up and say, I got a problem, right?
Right. The problem when you're hooked is that there's a shame factor and there's a secrecy factor, and it's a stigmatized disease. So no one is going to announce that at the dinner table.
Yeah.
And unfortunately, it becomes one of those surprises to a family, which becomes quite devastating sometimes in the impact it has on families.
Yeah. So we're going to take our final break here on Living Clean, Living Well, but when we come back, we're going to wrap this show up and have some final thoughts from Dr. Kumar Gupta and Daniel Kahn. Stay with us, folks. We will be right back after this break.
I've been through multiple treatment centers with my addiction, fighting it for the last 10 years, 17 detoxes, 3 different treatment centers.